Welcome back, everybody. We're now going to have a live debate. Conversion of public debt for investments in public health for resilience. Another consequence of the pandemic is that the debt of low-income countries has been further aggravated, compromising their development prospects. And of course, this means an adverse impact on public health and health systems, and consequently the economic welfare of countries and regions across Africa. So to discuss this, I'd like to welcome to the stage moderator Roberto Ridolfi, President Link 2007, and the panelists who are taking part in this discussion. Welcome all.
So good morning, everyone, and I welcome you to this debate, which in fact will combine two big topics. One is public debt, its sustainability and its impact on development perspectives. And the second will be on how to use an innovative idea that we will present today for investments in the health sectors. And I underline the word investments because we are trying to create a pitch, and our friends from Africa, in fact from Uganda and from Kenya, they will talk to us about ideas on how to invest in public and also private-public facilities in the health sectors to help the welfare of African nations. Today with me we have Erika Gerretsen from the European Commission. She's head of unit in charge of macroeconomic analysis and affairs, an old friend. You are most welcome, Erika. We have also San Bilal, who is a strategic senior analyst at the think tank ECDPM, well known in Brussels, I think you both. Unfortunately, we don't have in presence other two colleagues, Dr. Jerry Ichto, but he's on the screen from Uganda. Hi, Jerry. Nice to see you. He's from QAM. This is Doctors with Africa, and is an organization specialized in health sector in Africa since, you can imagine, 70 years, 7-0. And the other speaker with us will be Miss Jacqueline Chiari. Hi, Jacqueline. She is from Kenya. She will talk to us from Kenya. Now, the reason why Jacqueline is not around is, unfortunately, we couldn't get the visa in time for her to come to Brussels. And we apologize, Jacqueline, but you will certainly make your voice heard. And of course, for Jerry, the situation is different because he got COVID infections. So, Jerry, we are happy to see you on the screen. Now, let's start, and I will help myself in 4 or 5 minutes, not more, to present this idea, which we call Release G20. Can I ask you to put the slides? These are 5 slides. So, Release G20 is a flexible mechanism for debt conversion, sustainable development, and relaunch of international cooperation. Many times we hear about appropriation, ownership, okay? Ownership of the political movement towards development. Well, ownership means that I must have the resources to own something. Otherwise, my ownership is a little bit fake. Release G20 is a proposal for restructuring and partially converting the debt, transforming it into an asset. So we are not talking of debt cancellation. There was an experience at the occasion of the millennium, you must remember that, an experience that was partially positive. Very quickly, the debt that was cancelled in the year 2000 with the Jubilee program was replaced very quickly by new entrants like our friends, the Chinese, or by the private sector. at conditions that I would say even worse than those that were cancelled. But that's another story. Now we're looking on how to transform partially the debt into an asset for the country and use it for sustainable development, and in particular for health. That is the debate of today. We call, first of all, the initiative is called Release because it intends to release energies, strength. G20 because that is the place where such an initiative can and should be discussed. We don't think the OECD of the Circle of the Club de Paris or the European Union, by the way, could be the place where we discuss these issues. We need to involve the powers and the countries that own this debt. And they are in the G20. Not only, all the private sector that owns the debt is in the G20 countries. Promoting this is to accelerate sustainable investments, so to create from the partial non-payment of the debt local funds in the countries to build the guarantees like the one that you are running in the European Commission with the EFSD, the European Fund for Sustainable Development, or other guarantees of the World Bank vis-à-vis the investments. So today we will talk of these investments in the health sector. There will be, of course, a monitoring and control mechanism. I don't want to enter into the details. I want more to discuss with you and have you to discuss. But it's important the word ownership. So the governments must be in the hands of the country. You remember in the past we had, for those like me, Stabex funds in the very old days. These were counterpart funds that were generated in the local currency in order to do local investments. Similarly, Release G20 proposes with the non-repayment, partial non-repayment of the debt to create local funds to guarantee investments from the point of view of that country. I don't bother you with the circle of sustainability, permanent production of debt burden. We have problems on financing for development. We have problems in the international sustainable growth, and we have problems to reach the SDGs. So this is a spiral that we all know. Now, I want to stop my presentation here. So asking our colleagues, we will have, and in particular, Erika from the Commission point of view. You have faced many analyses with a lot of countries. You have passed through the experience of budget support. You know that sometimes debt is bad, sometimes debt is good, and, but debt must be managed and must be sustainable. Otherwise, there is a sense of suffocation in the country in order to run the affairs. So I would hand over to you for your presentation of about 7 minutes. Thank you.
Thank you. Thank you very much, Roberto, for your introduction and for inviting DG INPA to this discussion. Indeed, and it's really a pleasure to sit between those two gentlemen who are very active on these topics, and to have the colleagues online, and really looking forward to hearing their own presentations. I think, Roberto, you have indeed outlined the situation really well in terms of levels of debt, which are now becoming extremely worrying in many low-income countries. Debt was actually already increasing before COVID, and COVID and the need to create fiscal space during this crisis has led to indeed even more worrying debt levels at this point, with many countries now facing a situation of risk of debt distress. In this context, the EU is looking at the situation a little bit the way you're doing this, in the sense of looking at the financing and the investment at the same time, because these are really the two faces of the same coin. And while looking at the financing, we still need to ensure that there is sufficient, that there are sufficient means available for the investments, which are very badly needed in the health sector, obviously, which we will mostly discuss today, but also for all the other sectors and dimensions of the SDGs. So what does this mean from the European Commission's viewpoint? We are strong supporters of the multilateral agenda. We have been supporting the common framework for debt restructuring, which so far is only being applied or requested by 3 countries. So for now, it's only Zambia, Chad, and Ethiopia which have requested the use of the common framework. And this is a new framework which has exactly been established in the context of the G20, and this is what makes this tool innovative. We are also, as Commission, we have been supporting debt relief operations, in particular supporting the CCRT fund of the IMF, where we have been the most important contributor to the Catastrophic Containment Relief Trust of the IMF in order to release debt from partner countries during COVID crisis. Also very important from our side, we have been supporting, and we are still supporting, the SDR allocation, the special drawing rights allocations of 650 billion, which has been decided and started during in the G20 context and decided in August of last year. This major new allocation of SDRs really offers the opportunity to provide financing to partner countries at concessional terms. In this context, of course, as we know, only out of the 650 billion, only 21 billion goes to low-income countries. This is not enough, and this is why we are very much supporting the on-lending of SDRs from the more advanced economies to the low-income countries, so as to provide the capacity for the IMF to provide funding through the PRGT, so the Poverty Reduction and Growth Trust, as well as the newly established Resilience and Sustainability Trust, where this health discussion that we are having today can find an important route. At the same time, we are indeed continuing providing budget support. As the European Commission, we are the biggest contributor in the world in grant budget support. This remains really pure grant, and it's important in the context where there are numerous innovative financing tools, which is absolutely essential, but at the same time, grant remains an important element of the toolbox. And this budget support instrument has at its core the word that you started at the beginning of your intervention, which is ownership. And so let me now move to the second side of the coin, the investment. When doing investment, we really need to ensure that this is purely aligned to the country strategies, to the country policies led by the government, but also with civil society being actively involved, with the parliaments being actively involved, and really in the whole of the society dimension. And this is why I really like the idea of having tools and proposals that really go down to the country situation and can ensure this country ownership. At the moment of the COVID crisis, we started this discussion about debt swaps, and there was a lot of interest in looking further into potential for debt swaps. So we took the initiative to start to launch a study together with the most concerned EU member states to look at the potential of debt swaps. So we have provided a study on this, and I also think that the IMF will shortly release a paper on this topic, and this might also provide interesting insights for this discussion that you are launching and the initiative that you are proposing today. Debt swaps are an interesting tool. They are an interesting development tool. Indeed, as you said, Roberto, it's not debt cancellation, it's debt conversion into something that allows the financing of useful investment in underline with the SDGs. In this discussion, we need to have the finance ministers on board, because at the end of the day, it's really them, and also in the context of the Paris Club, they are the ones that are the most concerned by the debt restructuring and could potentially be interested in this kind of instruments. So working in the G20, yes, is the good framework because you have all the interest, all the important people around you and around the table. But working with the Paris Club members is also important. The European Commission is not a lender. We do not lend money to partner countries. For now, we only have guarantee instruments and other tools. So we do not provide these loans ourselves. We are not concerned ourselves by any debt cancellation or conversion, but certainly interested in continuing this conversation with you. Thanks a lot.
Thank you very much. I think we got 2-3 good news from you. The first one is this call of on lending from advanced economies to poorest countries, because we, the civil society, don't underestimate that this proposal of macroeconomic is coming from a network of NGOs, which I have the honor to chair, Link 2007. And we don't take extremist positions as NGOs, saying cancellation of debt, that has been a position historically achieving nothing. We are a little bit more realistic and we say, okay, like the debt swap, let's try to convert this obligation in something that inspires. You know that the budget of a government is recurrent expenditures and investments. So vinculate, link the conversion of debt to investments is a first step. The second step is to make sure, as you said, that they are aligned with the SDGs. And the third step is to make sure that these can be repaid once in order. But we also welcome that the common framework is on the making. We will see the experience of Zambia, Chad, and Ethiopia. We know that the European Commission is providing budget support only through grants. But we also know that a lot of developed finance institutions from the European Union, including the EIB, they provide sovereign loans. And this is good. Sometimes it's not. We speak as NGOs. Sometimes projects must be looked at more carefully, perhaps. But this is a discussion that will continue. Now, we switch from the financial economic perspective to the health sector. And I would like to call upon Dr. Jerry Icto from KUAM. He will deliver his speech from Uganda. You have 7 minutes, Jerry.
Good. Thank you very much, Roberto. Coming most especially from the point of the investment. If these resources are made available, where will we really want to put this investment? There are quite a number of areas of interest for investment in health, but coming from the experience of Uganda and also relating more to the global health challenge, especially the problem that we are moving on right now, which relates to antimicrobial resistance. I will say that that will be one area of interest that such an investment will look into. We are currently seeing a lot of change in relation to rising cases of antimicrobial resistance globally. For example, in 2019 alone, we saw over 27 million people, 1.27 million people dying from issues related to antimicrobial resistance. And of course, the problem was much, much bigger in the African context, where we are seeing we registered over 30 per 100,000 people dying as a result of challenges related to antimicrobial resistance. And for example, in Uganda, resistance to respiratory pathogens, for example, tuberculosis, is also an emerging big threat. We expect in Uganda about 4.7 cases of resistant tuberculosis per 100,000 people in the country. So it tells you that the challenge related to resistance on antimicrobial is big. And this was also recognized by WHO, listing it among one of the global health challenges that we have to work on in this decade. Of course, like for Uganda, the government has also recognized this, and it has actually aligned itself to global aspirations by also designing the antimicrobial resistance action plan. This was developed in 2018, stretching up to 2023, a 5-year plan to really address this gap being recognized by the government here in Uganda. So this, of course, working on the One Health platform, where they're looking at animal health, human health, and the environment to address this big challenge of antimicrobial resistance. But of course, this is being coordinated under the One Health platform at the national level, and there is a subcommittee on antimicrobial resistance that has been created, working with many stakeholders in health, agriculture, and the intergovernmental ministries working together to address this gap. However, the challenge has been really operationalization of those plans. Many of them remain on papers, on books, because of resource constraint. Where do we get the resources to ensure that we actualize the plans? Very beautiful plans are available, but then the operationalization and actualization of them remains a big problem. And so really, if we are to invest and if resources are made available, addressing the capacity for countries, especially in low-income setting, to be in position of, first of all, preventing antimicrobial resistance, and then slowing the ones that have been already detected, slowing their spread, and then also being in position of getting novel approaches to addressing the gaps in relation to new antibiotics that can be in position of treating infections. Those will be the areas to go into. And of course, this cannot happen if, first of all, the laboratory capacity to generate evidence, first of all, for this antimicrobial resistance is also enhanced. The issues of the human resource capacity to be in position of doing this work also needs to be looked into. So for me, these will be areas that we will take into consideration when we want to address and improve the issues of antimicrobial resistance. Of course, looking at the health system lens, where you want a good system to be in position of responding. We've seen this recently in the COVID-19 response, where the system is put with a good infrastructure. Then you see the response was much better, including even uptake of vaccinations, requiring all these infrastructures to be well aligned so that the system can respond. Of course, while knowing that if we support it, for example, in places, countries in Africa, we'll be contributing also to attainment of the global sustainable development goals related to health. But without emphasizing this also in African countries, then we will be missing the point in attaining of our global aspiration. So this is what I will briefly say from my presentation. Thank you. Over to you, Rob.
Thank you, Jerry. So Dr. Jerry Icto from KUAM, the Doctors with Africa. And I want to underline with. Is not for, is not in, is with. And KUAM is one of the 14 NGOs part of the network Link 2007. These 14 NGOs are working in 57 countries with about 400 million of projects every year and with 12,000 people in different countries. NGOs are one pillar of the development cooperation. Investments are so much needed, and I think Jerry told us that they can create employment with private laboratories of analysis so much needed. I remember these very well-run hospitals in Karamoja, in Uganda. They have sometimes to send the blood test all the way to Kampala. You create a lab in the region, there is a market to flourish and prosper, creating jobs, employment, etc. We continue with our Africa perspective with the intervention of Jacqueline Chiarie. She is the regional program management of AMREF. AMREF Health Africa is another NGO of Link working in health in Africa. Jacqueline.
Thank you very much, and glad that we are having this conversation. And I want to pick up from where Erica left. And we are really glad that this conversation on the debt conversion is already happening. Because clearly one of the things that affected us a lot during the COVID response is that most African countries were found flat-footed. We did not have the resources to manufacture any health commodities in the response. We did not have resources to engage our healthcare workers, our community health workers to participate in the response. And therefore, this discussion becomes very handy. Also glad that she's mentioned that they're already working with governments, because this is very critical. Critical that we work with the right people, in the right policy environment, in the right capacity to ensure that we can make the right decisions. So one of the areas that I would request we spend our money on is strengthening overall governance. Governance, because we have limited resources. I think most of the African countries have already committed to allocating about 15% of their GDP to health. But when you look at our performance, very few countries, not more than 5, are allocating the necessary health resources to health. That means there is a great need to increase resources. And with increased resources, then we need better governance, because then we're going to have the right technical capacity to ensure that we can identify our priorities, where this money should go. We are going to be making the right decisions in as far as resource allocation is concerned. So making sure that we have the right priorities, that we are allocating the necessary resources to these priorities. And anytime we talk about resources, then we also want to talk about accountability, which is where our NGOs and our civil society organizations come in. There's definite need to strengthen their capacity for social accountability, because we want to ensure that whatever governments commit to when these resources come back, that they actually follow through, and that these priorities are actualized, and that we have stronger health systems at the end of the day. So the first thing, let's strengthen governance by making sure that we have the right people making the decisions, providing the right technical assistance so that we can identify our priorities and make the right health allocation. And on the other side, ensure that there's accountability for these resources. So very clear involvement of the NGOs and the CSOs that we have in the country, in Kenya, for example, to ensure that the government can follow through in the way that these resources are being used. The second thing is around health security, and it's something that Dr. Jerry has talked about, because one of the things that we realized during the COVID response is that there was quite a bit of misuse of antimicrobials, because people took the antibiotics, the antivirals, before proper testing was done. Confirmation on COVID was done, and therefore quite a bit of misuse was realized during the COVID-19 response, which means that health emergencies in one way or another contribute to AMR and vice versa. And therefore, the second place that we want to invest our resources is in strengthening health security. One, we want to ensure that our health workforce is fit for purpose. We want to ensure that when they come from the training institutions, they are aware of what health emergencies are and how they respond to them. So support to our training institutions to ensure that we have the right curriculums, that our health workers are properly trained, and that we have enough healthcare workers to be able to respond whenever we have health emergencies in the region. Other pillars, critical pillars in as far as health security is concerned, is strengthening diagnostics. A country like Kenya, for example, at the onset of COVID, we only had about 39 laboratories that could conduct the PCR test. And that is a test that is the confirmatory test for COVID-19. With 39 against a population of about 50 million people, obviously we cannot be able to conduct the right surveillance or diagnostics in as far as health emergencies are concerned. So strengthening diagnostics also becomes very critical. So strengthening our labs, increasing the number of lab technicians we have, so that anytime we have the threat, we can quickly detect and be able to respond adequately. The other thing is around surveillance. And I think this is something we have learned from all the work that we've been doing in the region in as far as responding to health emergencies is concerned. We know that these diseases are first detected at the community level. And therefore, how do we involve our community health workers to strengthen surveillance at that point and be able to report any threat to the right authorities and ensure that there's right follow through. So the third thing is around ensuring that we can strengthen community surveillance. And that means working with our community health workers, training them, letting them know what the priority diseases are, so that anytime there's suspicion, they can quickly report and proper diagnosis is done. So the first thing, as far as I'm concerned, let's strengthen governance, because once these resources are available, we can make the right decisions around it, and we can strengthen accountability to ensure that what we commit to actually gets done. The second thing is health security. Let's strengthen health security by ensuring that we have the right health workforce, we have proper diagnosis, we have right capacity for community surveillance in everything that we do. Last but not least, strengthening our local manufacturing capacity. And we're not talking vaccines only, because when we have health emergencies, a lot of us went helter-skelter, even trying to get the most basic of commodities that are required in any health emergencies. Things as basic as, gloves that we need anytime we handle our patients at the health facilities. We had a lot of our pregnant mothers being turned away from health facilities because our nurses did not have the proper PPE to be able to attend to the patients, to be able to attend to the clients, to be able to attend to our health, to the pregnant mothers. And therefore, strengthening local manufacturing capacity becomes very critical. Can we exchange technologies? Can we get the right technical assistance to set up our own industry so that we can strengthen our manufacturing capacity, so that anytime we have a health threat, then we can quickly produce the health commodities that are required during health commodities. In summary, let's strengthen health governance, let's strengthen our capacity, our health security capacity, because then in that way, everyone is safe. If Africa is safe, then the whole world is safe. Thank you very much.
Fantastic. Thank you very much, Jacqueline. I think that she has been very clear. And so, with no further ado, Sal, as often it happens to you, you have a sort of put things together. The needs in the health sector, which has been exacerbated during the pandemic, and now with the war will be even worse. The needs of finance ministers that need to keep the accounts in order. The needs of creditors that legitimately expect the credits to come back. But of course, at the end of the day, what it matters to us are the needs of the people.
Thank you very much. I'm not sure I can bring it all together, but let me start at least with the global situation, from the global picture, and then I'll come to the more specific. But on the global picture, I'm still quite amazed by the lack of global reaction to the current situation. I mean, we are really in a very special time with convergence of different crises, and what Christine Lagarde has called also, a state of permanent crisis. It seems that we have one crisis after the other, greater uncertainty, but we have huge crises. I mean, the climate change that has to be addressed, the COVID-19, now the Russian war in Ukraine, makes that we are not in a situation of normal. And I've been, as you can see from my gray hair, or what's left of it, you see that I've been in the business for quite a long time. We've talked about debt problems for a long time. But honestly, I think we're really a historical point of time in terms of the size of the crisis we have. And then the question is not, do we need debt restructuring or not, or something, or what is the specific action, but what can we do? And we need to respond at scale. So if I think how to respond at scale, what are the tools that we have? Well, the first point is we describe indeed the debt crisis that was there before and that is increasing further. If states do not have the capacity to, don't have the fiscal space to respond, and we saw a huge asymmetry between rich countries and poorer countries, we are going to disaster. So we need to do something about debt restructuring. The second element is, where's the big money? Erika mentioned this allocation of special drawing rights. But this is, most of it goes to the rich countries. And the poor countries, 21 billion for low-income countries, 33 billion for Africa. I mean, there is a commitment at the G20 to reallocate at least 100 billion of SDRs equivalent. Now, what has happened so far? Very little. I mean, there's a creation by the IMF of the IST, but the commitments by countries to reallocate to the PRGT and the IST are still not coming. And in Europe, only the three big countries, France, Italy, and Spain, have made large commitments, but the other ones are not. So we need to have much more commitments. What is Europe waiting for? What are European member states? And I don't say Erika, because we know the position of the European Commission. But what are European member states doing? And if they cannot, like Germany, directly reallocate, think about equivalent of reallocation of USDRs. This is really important. This is where the large amount of money is coming from. And it should be reallocation through the IMF, but there is also a possibility, at least in principle, to reallocate to public development banks. At least those that are so-called prescribed holders. Again, where is the approach and the innovative? The African Development Bank is trying to do a lot to be able to use some of them, but there's not much support to do so. The European Central Bank said, no, we cannot do it. So I think here we have a really systemic question. And the third one is we need to be able to stimulate investment. And that's this element of, how do you do from SDRs to go for, why do you want to give SDRs not just to the IMF, but also to public development banks? It's because you want to have a leveraging effect and be able to, from $1 of equivalent of SDR, to be able to leverage $3, $4, $5 of investments. So if you reallocate $100 billion of SDRs, then you could go, have $500 billion of investments. That's what we should try to be aiming at. And I'm very surprised that, this is not really happening. And I have to say, even among the public development banks, that are most of them thinking about business as usual, not increase the use of guarantees. The European Commission is providing guarantees, but the budget that was created was, was less than what the Commission was asking in 2019. And we have all these crises, and we're saying, no, that's fine, we're implementing what we have. So I think we don't have the scale of what we want. The second, to stimulate investment, is this notion of debt swap. So debt swap for health is indeed in itself an interesting concept to be adopted, and I'm curious to see what the IMF will be saying about it. But there's still a lot of problems with the debt swaps as well. First, you need to have a will to restructure the debt, otherwise it's pointless. So we need to engage, and you were right, Roberto, to say we need to work at the G20 level. Then you cannot just have debt swap in a vacuum, because if you have countries that are not willing to spend money on health, for instance, then okay, you have a debt swap, and they will dedicate less of their budgets on health, spend it on somewhere else, and say, okay, we comply with you. So you have an issue of transfer that can happen. So what you want is that the debt swap is part of a comprehensive element. It can, because you don't want the local government to dedicate less on this budget, saying because of the debt swap they will do, and you don't want to have the external support to say, oh, we're going to invest less in health in your country, or climate, or other topics, because you can have different type of debt swaps, saying, well, in fact, that's the equivalence that you got. So I think we need to have the very comprehensive. The last point is on the health, and I mean that at ECDPM we've been doing some work also on the debt issue. We had also a paper coming 6 weeks ago on this issue, and we're preparing one on pharmaceutical manufacturing. The European Commission and the EU globally is doing a lot to support an initiative by Africa on how to stimulate the vaccine and pharmaceutical manufacturing in Africa. So this is really positive. But if you want to do that, and that's what we're seeing, is you cannot just focus on production. You have to think of what does it mean? What are the barriers? If you do it at Africa with regional hubs, that means you need to have better regional integration. You need to have agreements on public procurements. It's the governments that is going to buy a lot. Otherwise, it's not going to be viable, at least for vaccines. You need to have regulatory harmonization. You need to have the support on the health system and so on. So my last call is to say we need to have comprehensive approaches, but this will not happen if we don't realize the large crisis that we have. And if we continue the way we're doing now, we are going to have much bigger problems in developing countries, but believe me, also in rich countries, because this will have very bad repercussions. So investing now on debt restructuring, on investments and so on, for rich countries, it's investing in their own future. Because if they don't, the situation will be much worse in the future.
Thank you, San, also for this call for actions. Now, Slido. This is the word, the magic word. For the few minutes left, if there are questions, you know it works with the slido.com. You take picture of the QR code, and while you do it, we will see the questions on the screen. But while we wait for the questions, I think that we appreciate the efforts of the EU on building local manufacturing capacities. We would appreciate a clear position at WTO on the TRIPS. We would appreciate a clear European Union position allowing for the temporary waiver for copyright in the case of vaccines. This is something that is still pending in Geneva, and that is one call that the civil society organization have been doing. I think I agree, also Erika mentioned that at the beginning. The reaction to all this crisis is too short, too little, too late, too slow. I wouldn't define differently. We need to, I think, elaborate together, and then I will ask you two to get two final remarks. We need to elaborate together on how to reach the community needs to the global frameworks, because at the end of the day we are interested in the quality of life of the people, no doubts, and we know that we have to trickle down a number of issues, including management of health. You mentioned the debt swap. I agree with you. It's like for green bonds. If you create a lot of green bonds and you don't have places to invest them, you will create a bad debt. The same for the swaps. We should put a rule that the swap will happen only when there is a certified investment, while the debt swap will go immediately. Compliance with SDGs. Erika.
Thanks a lot, and thanks a lot for all the really interesting interventions. And I mean, there's one word, and Jacqueline repeated the word, and I think this is really the important word: governance. Financial governance, governance of the health sector in particular, and making sure that indeed at country level there is this clear ownership, strong public policies, strong public finance management, and quality of the expenditure of public finance expenditure, making sure that this is really oriented to what the community, the society, and indeed the people need. So this is really for me at the core of what we are doing. We have this approach of the collect more and spend better, which is more valid than ever. We need to mobilize domestic revenues at country level. The tax to GDP ratio in many African countries remains far below what it should be in order to finance any development policy from the society itself. So collecting more in a fair manner. And spending better, which means indeed having strong public finance management mechanisms which finance the right policies. So that's really on this core dimension, which I think is really good that Jacqueline was making a bigger emphasis on. Debt swaps are not the solutions in themselves, and I personally do not believe that the debt swaps will be the big bang solution that Sal is dreaming of. But I do believe that in certain circumstances, in certain contexts, there is a scope indeed for elaborating on this kind of instruments and providing again the capacity for this home-based, country-based discussion on the objectives and the vision on society. So really happy to continue the reflection with you and with civil society actors on how this kind of instrument can be mobilized in certain partner countries.
San, one final word from you.
Thanks. It's hard to disagree with Erika, especially on governance. But, you know, Erika, you were saying I'm dreaming of a nice solution. But I'm not dreaming. I'm very realistic. We are in an interdependent world. And what I don't understand is, forget about we should help developing countries and so on. Just from a selfish interest for richer countries, if there's a huge debt crisis, they will lose their money that they have invested in developing countries. So if you don't want to lose your money, you've better think about how to restructure the debts. And the same for the private sector and the same for the Chinese. I mean, if they don't want to lose their money and they pretend nothing is going on, I mean, the IMF is not dreaming. You know, when they're saying we're on the verge of the precipice and we have to be careful about the debt and we have to come with a more systemic solution that we have been doing so far, they're not dreamers. They're just very realistic. If you want to save your money, you have to think about how you do it. If you want to invest, it's a growing market in Africa, in developing countries. Doing investment is not to do goods. It's something that is going to bring returns. It is very, very positive. So you have to find ways to use it. What is the point for rich countries to keep special drawing rights on their central bank accounts that they don't need and they don't use? When they can try to address the issue. So I'm really saying, use your self-interest. And the same for COVID. We saw with COVID-19 how we were dependent on variants that are coming from other part of the world. So thinking that Europe or rich countries will solve it by themselves, well, no. So just be selfish. Don't dream, be selfish, and do something. That's my call to the rich countries.
And that is an implicit agreement with the proposal Release G20, which I thank you for the participation in this debate. I want to thank Jerry Icto from Uganda and Jacqueline Chiari from Kenya. Thank you very much. We will continue the discussion on debt restructuring for better investments, for domestic resource mobilization, but also eliminating some absurdity of the rich world that keeps SDRs that don't need instead of giving to those that are in need. The civil society is ready to engage, and I would like to thank you again, and we are ready to continue the discussion. Thank you to all of you. There were no questions, but I'm sure that you have many questions to ask. Link 2007 will thank everybody for this participation, and perhaps we see each other next year.
Thank you very much for a very interesting discussion there. A fantastic shopping list of things that money could be spent on, including AMR resilience and also strengthening governance and strengthening health systems. And of course, thank you for highlighting the urgency as well of thinking about what to do with all this debt. Thank you so much. We're going to have a very short break now, about 10 minutes, and then we're going to be back for a session on AI in healthcare at 5 minutes past 12. See you then.